Social prescribing is all about connecting people with health conditions or with low mood and kind of experiencing kind of challenges with their quality of life, connecting them to opportunities in their community that's going to boost their well-being, but also hopefully help them manage their condition and improve their health in the longer term. So we've been doing research into social prescribing for more than 10 years now, and we've always used really traditional methods, and we wanted to develop a method that was much more community-based and community-focused, and we wanted to kind of demonstrate to funders that that was a really meaningful way of capturing evidence from community members. So a really good example might be somebody attending a exercise class in their local community centre that's facilitated by an expert kind of physical activity trainer, but also at the same time they get opportunities to meet people and make friends and connect socially. So they're kind of getting physical activity, but also getting social connection at the same time. This project is all about people who might be living in the community at risk of frailty. So this is predominantly older people whose health is starting to decline, because we know that frailty is a real risk factor in terms of people's deteriorating health. So we want to understand how community-based approaches can prevent frailty and delay the onset of kind of poor health conditions.
So we were chatting to a consultant who works in the falls clinic or at the hospital, and so if someone has a fall and they come into hospital because of that fall, maybe it's quite minor, they get checked out, so neurological tests to see why they had a fall, and quite often there's no particular reason, nobody really finds out why. So then they get referred back to their GP to take care of them. The GP probably refers them to the falls prevention team, and the falls prevention team will come out and look at their house and check that they're not going to trip over their carpet, or give them advice about preventing falls in their house. But there doesn't seem to be a lot about trying to address frailty, and what this consultant said to us was, I know that the people that are coming into my clinic are more likely to become frail, that the fall that they've had is kind of a warning sign, and yet it doesn't feel like there's a lot of action going on in the community.
So we were focusing on the community of Darnall and Attercliffe because our community partner was Darnall Wellbeing, who's the community anchor organisation for that community. And we also know that's a really kind of ethnically, culturally and racially diverse community who often struggle to access social prescribing services. So we wanted to capture evidence from their perspective to inform services that are kind of meaningful to them.
They hold the experience, the lived experience of particular issues and the knowledge of the issues that affect their local community. And so this was a way of involving them, and also at the same time building their capacity in terms of their personal and professional development, building their skills to be able to use them beyond the lifetime of our project. We use co-production because this approach allows you to involve those people who are closest to the issues to be involved in research.
So what we've done is we used our existing networks and the groups we have, where people come for different activities weekly or monthly. So when we went back to them and showed them all the information about, and the people, some of them they chosen, like one of a men's group, at least 5 of them, they said that they would like to be part of it. And then the rest of that was the links we had made over the years in the community. So we, through working with individuals, we knew that what they are looking for, someone who is retired, someone who is looking for a job, someone just want to do something because they have some extra time. So we went back to those people who we knew that they have similar interests, and we asked them if they would like to be, and the response was really good.
Motivated me to become a community researcher. There were 2 things. One was that I'm already working as a community interpreter. I had 8 years experience, and this is the time when I was within the community heart. I knew their stories, I knew what was happening. So through my professional engagement, I developed a deeper understanding into community life. And second thing is that phase, obviously I was getting more and I wanted to know more about them. And also I have a mind as well that I want things to be changed. So when I was knowing what is happening in the community life, and when I was knowing that what the people's experiences was, I was automatically thinking that what could make it better.
What motivated me was basically my passion to make a difference in my community. I don't live in Darnall, Tinsley or Handsworth, but I live in the wider Sheffield area. And I believe this particular area, Darnall, Tinsley, or the Darnall Ward, I would say, is one of the most deprived places in Sheffield. I found it very, very interesting because I've learned a lot from it. I learned about research, I learned about those sort of values, the core values, those kind of ethics issues, and how a good research is done. What is not supposed to be included in a research to make it very authentic and make it valid.
I mean, it was something new to learn, you know, just to learn something new, you know, skills and everything, what we're involved in and stuff like that, you know, because day by day we're going to reach to that age, you know, one now or, you know, in future. So something, you know, just to learn and see how things, you know, develop and everything.
I got plenty of time on my hands now that I'm retired, and I've always wanted to do things for the community.
It rekindled my it rekindled my innermost, you know, voluntary work. So yes, when it came up, yeah, I like doing it. Yeah.
There are two parts to the social prescribing and frailty project. The part that we are leading on is the qualitative research, and that's about exploring what frailty prevention services and activities are out there. What are people's experiences in the local communities of using these services and participating in these activities?
So lots of people have long-term health conditions. Like I think once the time you get to 55, like half the population has at least one long-term health condition. And so there's lots of interventions aimed at those specific health conditions. But actually addressing people's frailty, or particularly that stage, that pre-frailty stage, before they actually become frail, but while they're at risk of frailty, has the potential to have the biggest impact sort of overall from a community basis on the whole community's health. So that's why we thought that the social prescribing and the link workers were a good way into addressing that from a community basis.
So I think what we've learned is that community members who need support would much rather access that support in their community, in community settings, than having to go into an NHS or hospital setting. This project was funded through Sheffield Hallam University's Research and Innovation Fund, SHRIF, who gave us the money to do this. That was really important because it enabled us to invest in Darnall Wellbeing as one of our community partners, and we couldn't have delivered this project without their support. We'd love to see our findings and our methodology be rolled out in other areas and be taken on board by the NHS and social prescribing partners around the country to think about how do we involve and engage communities in the delivery and design of social prescribing services that makes them more meaningful and accessible, particularly for more kind of diverse communities. We saw this as a pilot of the methodology and a pilot of the research topic and approach, and we want to then take our findings and and our methodology and make the case to some of the research funders to fund more research into this topic that engages a wider range of communities.
Our research found that frailty services in ethnically diverse communities should be based locally and provided by people who are culturally competent.
There is a need for community transport to enable more community members to participate in frailty prevention activities and services.
Information about the frailty prevention services and activities should be held on a database centrally but also locally in organisations such as Darnall Wellbeing.
Information relating to frailty services should be shared in formats that are relevant to different communities, engaging and easy to understand.